Hi everyone, welcome to Center of Balance Live. I am Sunam Phua from Center of Balance, the acupuncturist. Our live started again, being away for a holiday to Europe, learning snowboarding. It was fun. I'm gonna make some video and then post it up to show you guys how fun was it. Okay, we're going back to our daily life video every morning 7 o'clock. So today's topic is about acupuncture and Chinese medicine to treat angina. So we focus on stable angina. Okay. So with if you're an acupuncturist, a bit easier for you to follow in this live video. But if you are not an acupuncturist, and it's a bit difficult for you to follow it, that's because we're going to talk about some acupuncture point and meridian, right? So, so when you are here, please give me a thumbs up and say hello to me, and please share this video as well. And tomorrow, we're going to talk about acupressure point for angina. So what acupressure point that it can help angina. Okay, we're going to focus on acupressure point on angina, which is for everyone. If you're a patient, if you're a family that suffers from angina or your chest, just chest pain, and tomorrow topic going to help you. Right? And of course, the acupuncturist, you can show that to your patient as well. Right? Okay, let's start. Hi, happy day. Thank you. So the angina, stable angina, the symptoms of it, we talked about it last week or the week before, right? We talked about it. We mentioned about the symptoms. So for the Western medicines, diagnose, we talk about that too. Diagnosis stable angina, but using that Western medicine diagnosis, it makes a bit sense for us. But when it comes to acupuncture and Chinese medicine, we have our own diagnosis. Okay, especially when it comes to acupuncture, we need to know what meridian involved with the pain. So the meridian would be over here, right? Can be one meridian, kidney meridian, stomach meridian, spleen meridian. It can be over here, or lung meridian. It can be liver meridian. It can be liver meridian down here. It can be what do you call gallbladder meridian. So all this meridian, there are a lot of meridian in here, right? So we need to have a strategy that can help all this meridian. So an easy way, right? Over here, the pericardium 6, 3 fingers below your wrist, over here. So over here, they are 9 gong, right? So between the tendon and outside of tendon, the inside of tendon, you get 3 points. So on 3 different meridian, which is heart meridian, pericardium meridian, and lung meridian, over here, across here. Get the sensitive point. When you hit the sensitive point, put a needle in there. And then on, above that and below that. So 2 different levels, they come to 3 levels in total. So on this 3 level, they go to 3 meridian. So all these 3 meridian, if you find any acid point, needle it, and it should give you instant relief for any chest pain over here. So we only focus on local balance according to balance method acupuncture today. We not talk about global balance. If you want to know global balance about how to treat angina, you can go back to chest pain. Last topic that we had, chest pain. It will be the same global balance, right? So we focus on local balance today. Apart from that, you can do this as well. Spleen 6. So around spleen 6, well, there's 3 chun, right? And here, there's spleen 6 over here, from here to here, over here. So in here, you can go along this area, 3 chun, 2 chun, right? Or 2 to 5 chun around here. That is our chest. And what happened is, again, you go for 3 meridian. Liver meridian, spleen meridian, and kidney meridian. Get the ulcer point. If there's any ulcer point over there, insert a needle in there. Yes, it can target all your chest pain. All your chest pain. Now I know you may get tingling and numbness in your hand, right? When this happen, you needle here and here, it should help the tingling and numbness because treating the heart, treating the root of the cause is the heart that causing the problem. So treat the heart directly. Now, if the patient happen the angina in front of you, you needle it, feel better, and all afterward, they feel okay, my chest is pretty okay, especially when you put needle in here, and I still have tingling and numbness in my hands. And what do? If hands tingling and numbness, let me show you one. You can put needle on here, which is large intestine 4 or 3, and needle through one needle and toward to pericardium 8. Pericardium 8. Okay, large intestine 3 or 4, and one needle 2 point toward to pericardium 8. So when you go to pericardium 8, stimulate the needle, twitching the needle slowly, and ask the patient to move the fingers, and that will quickly relieve the numbness. You can do it on the opposite side. That numbness in here, you can do it on that side, and ask the patient to move hand in here. Or of course, after that, you can needle here as well, and twitches in here, and pull out a needle and ask the patient to move the hands over here. So those are the common acupuncture strategy that I would recommend you to do for stable angina and for the tingling and numbness, and for sweating, for the heart pain, for the chest pain. Right? It's so simple, isn't it? So simple, right? When it comes to Chinese herbs, so I take pills and then prescribe the herbs. I can just take pills and use and select the point of needles. Okay, so when it comes to pain in the chest, angina, and Chinese medicines, you can use 血府逐鱼汤, 血府逐鱼汤, or 炙甘草汤, or 泻白半夏泻心汤, if it's related to the stomach. And it also can use what do you call it? 桂枝茯苓丸, 桂枝茯苓丸, and 半夏泻白白酒汤. All this formula are good for angina. But I know that a lot of you that are watching this live, you don't know about the herbs, or you only know herbs a little bit, or you're in a different country and you can't get all these herbs. But yes, let's just focus on acupuncture and just name some formula that it may help the stable angina by using Chinese medicines. Okay, but if when I treat stable angina, I always come with herbs and acupuncture. Okay, both as a combination. Right. Now, of course, changing diet is important because it all build up from it come with the narrowing of the artery, right? Causing the angina. So the plaque that build up is from cholesterol and fat. Yeah. So we need to change our diet to make sure that the blood go through properly. That's one thing. Then when the blood goes through properly, then it can subside symptoms and it can help the stable angina. Now, if you can reverse it, there are a lot of books, especially the China study, that actually show a few cases in there, and the doctor, specialists themselves, they help people open the heart and fix this problem, and they end up with the angina themselves. Then they change the diet, then they fix themselves. Okay, reverse it. Real story and true story, and I encourage you to get the China study and read it through. And if you suffer from stable angina, and it's gonna help you a lot, right? That's it for today, and I hope you all get it, and I hope this all these tips, acupuncture tips that help you stay awesome, and I'll see you tomorrow. See you, bye bye.